Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here with your Monday educational moment. Today I want to give it a shout out to Stephanie who gave me this idea last week. I was talking to her and she's like, "Oh, you're a physical therapist. Do you know anything about plantar fasciitis?" And I was like, "Well, yes, of course I do. What's your problem?" And she was telling me for the past year she's gone to see a podiatrist and she's used all the home remedies, and her plantar fasciitis had started with an overtraining, a walking program that she was doing, and now for the last year she's been unable to do any of her usual walking and fitness and stuff because she's been fighting this terrible foot pain. Our feet are so important and they really do drive our health of our whole body, so it's really important to take care of your feet, and if you're having problems with your feet, to seek treatment. But I want to give y'all a little lesson on what is plantar fasciitis today, let you know what those home remedies are, and also let you know how we can help you beyond those home remedies as far as physical therapy is concerned. So here's my visual today. This is the Achilles tendon coming from the calf muscle. This is the calcaneus, your heel bone, and this is the plantar fascia. So it is what supports the arch. It's what keeps all these bones in good alignment when you walk, and it is a very strong attachment right here. So what plantar fasciitis is when this gets tight and extra fibrous from training, from people with high arches tend to have this more often than people with fallen arches, but whatever it is that leads you to get this problem, it's usually inflammation right in here. Pain with the first step in the morning is a big thing that we look for true plantar fasciitis, because it stiffens up in the middle of the night, and then that first step on it stretches it out and really gives you the sharp pain. So if you're having this first pain in the morning, or having pain in your heel region or in your arch region when you're doing training, a few things you can do for yourself is calf stretch, calf stretch, calf stretch. I talked about it a few weeks ago. The calf is directly connected to the calcaneus, is directly connected to the plantar fascia. So stretch out that calf, long, prolonged, moderate stretches. Shoe rotation. If you do have several pairs of tennis shoes, don't wear the same ones for each run. Came from a study done a couple years ago. Shoe inserts. You don't want a gel insert or something really squishy. You actually want something with a really firm arch support. Some of the ones I've seen have actually plastic there and then a small foam covering that's still kind of firm. The night splint is something that is recommended technically, but those take up to 3 months to see results from, and that's wearing it every single night. And it's there's a couple of versions that are a little more comfortable than like hard plastic, but they're pretty uncomfortable and you have to wear it every night. And then the most common one that you hear people rolling the foot on a frozen bottle or a tennis ball, just trying to work out all those fibrous adhesions that are tightening up that plantar fascia and pulling on that heel. So those are your home remedies, and things that are beyond that. If those don't work, then you need to come see a physical therapist. We can do calcaneal mobilizations to get the heel and the talus and all that moving better, all those bones moving better. We can do actual soft tissue release on the plantar fascia. We can roll out the gastroc, teach you a few things there. The calf muscle, I actually can needle that, and that can give a lot of relief. It can release all the pressure that muscle is pulling on the heel bone. And also, I want to show you there are a bunch of muscles in the foot, so we can also train those and make sure that they're adequately supporting the plantar fascia as well, with an active assistance to that passive plantar fascia structure. So I know that got a little lingo-y there. I'm sorry about that, but I definitely can help anybody that's having this problem, or most physical therapists can. So please ask your podiatrist or your physician and get in to see us so that you can get back to your active, healthy lifestyle, and also have healthy feet, and that's just makes you feel better in general. Everybody have a happy Monday. Bye, y'all.